treatment options, there are so many treatment modalities available now. Will not need any treatment, people who can be cured with treatment. Chemotherapy, you need to understand there is nothing called chemotherapy. There are different types of chemotherapy. They are very helpful. It's like a knife, but you need to use it very carefully by an expert who can use the knife. When it comes to treatment options, there are so many treatment modalities available now. There are three groups of blood cancer patients: people who will not need any treatment, people who can be cured with treatment, and people who can be treated or managed or controlled with treatment. Now, when I started in the field of blood cancer, there were limited amount of drugs. Over the last 20-25 years, it has developed a lot. One of the things you have heard is probably the word chemotherapy. Now, when we talk about chemotherapy, you need to understand there is nothing called chemotherapy. There are different types of chemotherapy. There are injections, but this word chemotherapy has sunk into our brain as the scariest thing in the world. Now, chemotherapy is not like that. It is very helpful. It's like a knife, but you need to use it very carefully by an expert who can use the knife. Now, moving away from chemotherapy, when it comes to blood cancer patients, most blood cancer patients will not have chemotherapy nowadays. What they have is what we call newer drugs or targeted treatment, immunotherapy, or what we call novel agents. They are specific to cancer. They are specific to cancer cells, and they cause less side effects compared to conventional chemotherapy. Don't get me wrong that they are with side effects, but they are not causing conventional or the side effects you have heard about: vomiting, hair loss, etc. So that is a very big advantage when it comes to new treatments. They are more specific to cancer cells, and they are not affecting the normal cells as it used to be with the previous chemotherapies we use. Now, when it comes to new treatment, there are their own side effects. Now, when you have immunotherapy or targeted treatment for a long time, people get allergic reactions. Some people have higher risk of cardiovascular disorders. So, specialists, a doctor treating you or using those drugs will be aware what to look for. Radiotherapy and surgery, blood cancers have a very limited space for those two techniques. We use surgeons only to diagnose blood cancer, that is only to do a biopsy. And also radiotherapy, blood cancers are not curable by surgery or by radiotherapy. We use radiotherapy for what we call symptom control. Now, if there is pain by time temporarily, then we can use radiotherapy for those purposes. Main armory in blood cancer physicians or hemato-oncologists are using chemotherapy, immunotherapy, or novel agents or targeted treatment. We have a special technique called bone marrow transplants you would have heard about. We need to talk about bone marrow transplants separately because it's a big subject. And again, there are different types of bone marrow transplants. That is a technique used to prevent a cancer coming back once we have got rid of the cancer.